everyone. Welcome to BlendedTV. It's September, the month of getting back into the routine. Kids are back to school, and you guys all get to get back to the gym. One thing that will remain constant is BlendedTV, Wednesday nights at 9:15, and we've got some great guests coming on the show, including tonight's guests. So tonight's guest on BlendedTV, we have Dr. Jayme Babin. Jayme has earned her Bachelor of Science from St. Mary's University in Halifax with a major in biology, and is a graduate of the Boucher Institute of Naturopathic Medicine in New Westminster, British Columbia. She's a member of the College of Naturopathic Physicians of British Columbia, as well as the Nova Scotia Association of Naturopathic Doctors and the Canadian Association of Naturopathic Doctors. With over 8 years of post-secondary education, Dr. Babin has an abundance of knowledge on how to treat both acute and chronic medical concerns, using tools such as diet and lifestyle counseling, clinical nutrition, acupuncture, homeopathy.
Yeah.
Man, I can't get through this. Spinal manipulations, herbal medicine, and injection therapies. She has a wealth of options to help her patients succeed in their health care goals. She embraces the naturopathic principles of treating the root cause of disease and spends time with her patients to understand the whole person and develop an individual treatment plan, believing firmly in living a balanced and happy lifestyle. She strives to help Nova Scotians attain their optimal health. Wow, that is a mouthful.
Yeah, you did well.
Literally, as a naturopath, you have your foot in a little bit of everything, which hence why you went to school for so long.
Exactly.
So I wanted to welcome you to the TV.
Oh, thank you. I'm happy
Thanks
to be
for
here.
coming out tonight. Listen, I mean, I've been in to see you a few times, on multiple occasions. I came in and saw you earlier this week, and we actually took a quick clip of it, and we'll show that clip now.
Okay.
So just on my way in to see Dr. Jayme Babin, who's a naturopath here in Halifax. Should be an interesting appointment, so let's see what she's got in store for me today.
We really do a lot with nutrition. Diet and nutrition is huge for us. Digestion is big. So we use different modalities. So here, for example, I'm doing a vitamin IV. Some NDs will do IVs. I also do some injections. We use acupuncture, homeopathy, diet, lifestyle, nutrition counseling, and within that there's supplements involved. But I always check with my patients too to see where their limits are. So if they don't want their spine adjusted, because we can do spinal manipulations. If they don't want those done, then I won't do it, or if they don't like needles, then we'll try and avoid doing IVs or injections, that sort of thing.
Mm-hmm. So I think that entire video could go on our blooper reel. I didn't pass out from the needle, but the video that I was taking, I ran out of storage on my phone. However, it's probably better that we didn't show it anyway. So I want to talk a little bit about the treatment that you did perform on me when I was in. And I was saying before, I mean, you've done spinal manipulations on me. You've also done some dry needling on me. And then of course, this week you gave me a needle.
Yes.
Before we get into talking about that treatment itself, one of the things that I wanted to kind of clear up for everyone is, what is a naturopath? I think there's a misunderstanding maybe, or just a lack of education with regards to what a naturopath is, what they do, and how you get in to see one.
It is a big question, because even for myself before, when I was living in Nova Scotia before, I had no idea what a naturopath was. So I think you're right that it's more of a lack of education, and we're not really aware of who they are and what they do. But we are similar to your family doctor or your GP in the sense that you can come in with any sorts of concerns or ailments, and we'll work to diagnose and treat whatever that is. Where we differ is how we treat, more or less. So we have similar education, the time we spent as you were reading.
Forever.
Exactly. So the modalities that we use are what's most different. Where in Nova Scotia, NDs cannot prescribe pharmaceuticals. That being said, we are well versed, and we do have a lot of knowledge in the field. So we know a lot about the drugs that you're on, so we can help mitigate side effects and so forth. But what we do instead, we use a lot of clinical nutrition. Diet, lifestyle counseling is huge, and it's really the foundation of what we do. And then beyond that, we do some traditional Chinese medicine, and that's where the acupuncture comes in. We use homeopathy, spinal manipulations. We use some injection therapies. Different NDs will have different therapies on top of our baseline as well, depending on courses that they do.
Yeah.
And yeah, that's kind of the gist of it, I guess.
The gist of it. Just a little
bit
of everything.
Just a little bit. A jack of all trades, one-stop shop. But what we can do, though, is if you come in and we don't, if it's not something that I can really help you with, I can at least direct you in the right path and saying, I think you should go see your medical doctor, or I think you should go see this person or that person. We can do that as well. We're more of the chronic cases and not the acute cases.
And I mean, we met in Vancouver. That's interestingly, both from Nova Scotia, have a lot of friends in common. We ended up meeting in Vancouver, and this was kind of in the middle of when you were going to school there.
Yes.
It's different in Vancouver than it is here, because in Vancouver, you guys can prescribe.
Correct, yeah. And that's new as well.
So is that going to change? Are we going to see
maybe someday
you guys have the ability to do that here in Nova Scotia?
Maybe someday. It's not looking like the very near future, but hopefully someday. Right now it's a slow process, and BC is much more advanced than we are here in general.
Yeah, I was going to say, in pretty much everything that we speak about on here, that's the case.
Yeah.
So is there anything else outside of being able to prescribe that's different from like what you were able to do and learned in school out there, and what you are not able to do here in Nova Scotia?
That's the big one.
Yeah.
Every province has different regulations as to what you're allowed to do and what you're not allowed to do. And for example, Ontario is very, very, very strict, even though they have quite a few more NDs there, and they also have a school there. The only other Canadian school is in Toronto, and they're very, very restricted as to what they can do. For example, they need a farm license in order to give a B12 shot, whereas I can give a B12 shot here. No problem. So there's some freedoms that we have, but the big thing is whether or not we can prescribe, and we can't do that here.
Yeah. So the B12 shot, that was a part of my treatment, wasn't it?
There was B12 in your Myers cocktail.
So it was a Myers cocktail that I took.
Yes.
And for anyone who is going out drinking, it is the perfect way to prevent a hangover. That was the case. Like I literally had Mel and Blake's wedding that night, and came in to see you that day, and kind of explained how crazy of a week I had, and you went through kind of some assessment stuff, and then you said, here's what we're going to do today.
Exactly.
And it was something different. We had never, like when I've come and seen you before, we had never done this. So it was an interesting one.
Yeah.
So what is it that the Myers cocktail can do for an individual? And how often or how likely are you to use that as a treatment? And how do you just decipher like who would get sort of like the treatment? Because there's so much that you guys do.
Oh yes, exactly. So it is.
How do you even figure it out?
Oftentimes I do. I check with my patients to see where their preferences are. So for example, if someone's deathly afraid of needles, that's not going to be what I'm going to jump to. But for the most part, most everyone can benefit from a Myers cocktail. It's a multivitamin that's a little more direct and a little more concentrated than taking an oral dose of any sort of vitamin, especially if someone has any sort of compromised digestive system, which a lot of people do and don't realize that that's the case. So they're not even absorbing. They could be eating the healthiest of meals and they could be taking all their vitamins, but they're still not feeling good. This is a really great scenario where a Myers cocktail can come in, because it bypasses the digestive system altogether and it gets the vitamins into the bloodstream right away.
And a lot of the issues that people have with absorbing nutrients and vitamins and stuff is based on their digestive system, which is kind of the route that you guys as naturopaths take over the gates, right? So if I was new to come and see you,
Right.
that would be kind of where you'd start, or like?
Most often, I usually start with digestion with most people. Mind you, if someone's coming in pain, I will try and alleviate that pain or something that's a little more acute first.
Yeah.
But we really are what we eat. And if
Yeah.
we're not digesting our foods right, we're not going to sleep well, we're not going to perform well, we're not going to have any energy, we're going to have brain fog. So people start to feel better once their digestive system is intact. So
Yeah.
they may not have a grumbly stomach or any other specific issues, but they may not be absorbing their food.
So for me, when I came in last week, you know, my irregular work hours, sleeping schedule, et cetera, I don't lack energy.
Right.
I've got tons of it. For when I sleep well, but we talked about my adrenals.
Right.
And I'm assuming the whole time we were having that conversation, I was just assuming we were talking about my adrenal glands.
Yes.
Okay.
Yes, we
Perfect.
just short form.
I was on the same ball. We were on the same page.
Good.
Fantastic. So, I mean, for someone who is a business professional or a professional of any sort, works a lot of hours, what sort of impact does your adrenals have on the function of your body?
The adrenals really are the powerhouses, and we neglect them and we don't give them enough.
Actually, we should probably say, what are they?
Oh, okay. So the adrenals are small, they're about the size of walnuts. They're small glands that sit on top of your kidneys, and they have a whole host of functions. Their main one that we think of often is they secrete cortisol, which is our stress hormone, which is necessary, but oftentimes, especially in North America, we tend to live a more stressful lifestyle, and so we can often have really high cortisol and affecting our sleep, and this is where the adrenals really come in. They also secrete aldosterone, which is a hormone that regulates your blood pressure by keeping sodium in your blood vessels.
Yeah.
So your adrenals can either spike your blood pressure or it can drop. And this is the case, and I often ask people if they have low blood pressure, if you stand up too fast, do you get dizzy or lightheaded? And
My answer is yes.
yes, and it's so common, and people get really surprised. I'm like, oh my God, yes. And then that's the case where I explain the role of the adrenals, and that's the case is that they've been working so hard for so long, pumping out cortisol for whatever reason,
Yeah.
that they're starting to tap out. They need a break, and so they're not even secreting aldosterone anymore. And so you're essentially peeing out all of your sodium, and you stand up too fast, and you get a party for one. And so that's when a host of other things can happen as well, because you're so fatigued at that point. They also secrete our norepinephrine and epinephrine, or adrenaline, which is adrenal glands, adrenaline.
Yeah.
And a huge part of it that we don't really give enough credit to is that they make some of our sex hormones. So for women, it's our only source of testosterone, and we need testosterone. And men, it's our only source of estrogen. And so it's a good balance.
So that's why I'm so manly.
Exactly.
My adrenals
Your
don't
adrenals
work.
yeah, exactly. Just full. But the
Did you guys
thing.
get that on tape? No, you cut. You cut. No.
Are we,
No, we're still live. I'm just kidding.
But so the testosterone, but it really comes into play, especially when you think of a gym environment, and you think that you want, the testosterone helps build muscle and burn fat, and so it tends to be a problem for women. And then that if their adrenals aren't working very well, then they're not getting, the only source of testosterone is from their adrenal glands, and they're not getting it.
So what are some of the things that people would notice in their day-to-day life that would say that there's some sort of issue going on with your adrenals? Like,
Okay, so it can also it can throw off your sleep. It can cause weight gain, especially around the midsection. Change in blood pressure. Either it's spiked in the initial stages where you're a little bit stressed, or it drops later on as you're more depleted. It also balances your electrolytes. So this is where you'll notice fatigue, or if you do a workout and you're completely wiped afterwards, or you do anything and you're just exhausted for no reason, you think that you should have the stamina for this, then you will want to start looking at the adrenals in that case. Those are big ones. We think of it for energy, we think of it for sleep, we think of it for stress.
I feel like that puts everyone in a position where this is something that they need to start paying more attention to.
Absolutely.
Basically, if you pass out, you can't sleep, you are fatigued, like you're putting too much weight around the midsection, all of those adrenal issues.
Exactly.
Potentially.
Exactly.
At least something that maybe you'd want to come and take a deeper look at.
Absolutely. And the adrenals also help regulate the thyroid. And we know how common it is to have people who have just an underactive thyroid. So
how can people, how can people either prevent this, A, and how can they also, if they find that they are affected by it, how can you help treat it in order to get them back on track?
The big things is lifestyle. If there's things in your life that are causing the adrenal fatigue per se, they either have to be removed or dealt with. Otherwise, it's just going to be band-aiding the symptoms over and over again. And so making sure you get enough sleep, you have a really good diet, and the big thing with diet is blood sugar regulation. You don't want to have a blood sugar spike, because if you have a blood sugar spike, then that means you're going to have a blood sugar crash. And when you have that crash, your adrenals start working and they pump out cortisol to get your blood sugars where they need to be. So you're making them work harder every time you have a sugary dessert, or you're not eating at regular intervals or anything along those lines. So a good diet full of fruits and veggies, mostly veggies, to get the vitamins that feed the adrenals.
So do you follow a specific diet type? I mean, we talk a lot, like in the CrossFit world, there's a few main diets that kind of people attack. There's like the zone, paleo, intermittent fasting. I mean, we could name a list of them, but there's a few main things that most CrossFitters you hear in conversation. Do you have one that you follow personally?
I am a fan of the intermittent fasting.
Yeah.
A lot of studies are showing how beneficial it is, not only for body types, but also for disease prevention, cancer prevention, Alzheimer's disease. However, for someone who doesn't have healthy adrenals, intermittent fasting can cause more harm than good, because you're having a blood sugar crash and your adrenals are working harder during your fasting hours.
I tried it one day.
How'd it go?
One day. No, I tried it for like 2 weeks.
Yeah.
I ended up losing. I found it really, really hard to eat enough food within that 6-hour period. So for those of you who don't know what intermittent fasting is, it's basically every single day you're going to fast for up to like 16 to 18 hours. So you have a 6 to 8 period window where you can eat. But the hard part is during that period, you've got to eat your normal daily caloric intake. So for me, in 6 to 8 hours, I have to eat, somewhere around 3,000 calories, which I found really, really difficult.
Yeah, and then there's some schools of thought where you don't need to replace those calories. It's also a bit of a calorie reduction.
Yeah.
And there's different ways to do it. Some people do a day on, a day off, a day on, a day off. Or I'm traveling, so it's an easy day to be fasting today. So,
intermittent fasting is great depending on your lifestyle.
Right.
Not great if you have adrenal issues.
Correct.
So
you want to fix the adrenals first.
You want to fix the adrenals, but basically diet is based on the individual. So you don't have a go-to, you're saying, is you've got all these different diets that are available or ways to eat. I hate the word diet. Ultimately lifestyle choices are very dependent on how your body reacts to them.
Exactly.
And how do you go about determining, or is this something that you do? Is this something that you work through with people, is to help them determine what sort of nutrition plan that they need to be following in order to best basically live their own lifestyle?
Definitely. That's the basis that's a cornerstone of what I do.
Yeah.
And I really try and work with people's diets, because I can do whatever I want, not whatever I want. I can do a lot of things in my office and send them home, and then if they're just if what they're ingesting isn't good for them, then it's just going to wreck it in the first place. So I do, but that's where my intake comes in. I spend 90 minutes in our first visit chatting and finding out everything that's going on for you. And then either the first visit or second visit, I do a bit of a physical exam.
Yeah.
And with that, then I can choose an appropriate diet for you and work with you to get there, because it's not an overnight thing. There's a quote that I read somewhere, and I firmly believe this, that changing someone's diet is harder than changing their religion. And I've seen it because people don't want to give up the foods that they love. And so it's a process and it's slow.
We see it in here in the gym. I mean, people get into a routine, they're finally working out, they see some results, and then they're like, well, I want to take that next step. Yeah. Next step is diet. It's the way that they're eating, and it's tough.
Yeah,
yeah,
definitely.
So going back to my treatment, the Myers cocktail,
Yes.
how would you say that helps the adrenals?
Well, it does. It provides you nutrition. A lot of the big vitamins that are in there: magnesium, calcium, selenium. There's a whole host of B vitamins. There's B complex, B5, B6, B12. There's vitamin C. So it helps your immune system, because when you're sick, your adrenals work harder as well. So it helps your immune system, but it also has 3 big vitamins that are good for your adrenals are B5, B6, and vitamin C. And all of those are in here, as well as other things to complement them. And so those are the big guns in terms of when we're talking vitamins as to what to help the adrenals.
Yeah. And I think one thing where there's still a disconnect over and above the fact that a lot of people don't understand what naturopaths do, that they do exist here in Nova Scotia, period.
Yes.
Although there's not as many here in Nova Scotia as what I feel like there were in Vancouver. I mean,
in Vancouver
is like every corner. It's like
congested with
Starbucks. Like you have Starbucks, you've got Cactus Club.
And an ND.
Exactly. And then on the other corner, you've got a CrossFit gym.
Exactly.
But I mean, for us here in Nova Scotia, it is covered in most people's benefits.
Yes.
And I don't feel like people understand that. Like,
no.
For myself, our benefits cover basically 300 in each one of the brackets, including naturopaths.
Yeah.
So it's one of those things where so many people will do their 300 of physio, 300 of massage, 300 of chiro, if we can get them to do that.
Yeah.
And then they're leaving this hole where they haven't taken the opportunity to seek out a naturopath and go and get looked at.
Exactly.
So I mean, this is something that is covered. Yeah.
Definitely.
Now, we talked as well, and this is kind of the last thing I want to chat about tonight, because I want to get you back on to talk about some other issues that you see coming through your doors, and how as a naturopath, you're like going to be my go-to naturopath.
Great.
Okay. So with naturopaths though, like, what is something that you would say? I mean, we talked about naturopaths specializing. Do you find that here in Nova Scotia you've kind of set your cornerstone of like, this is the type of patient that I prefer to see, or are you pretty generalized still?
I'm pretty generalized. I find I want to say that I see a lot of digestive cases.
Yeah.
But that's not really what they're walking in with. That's what I'm fixing
Yes.
first. So it's so common that's what I'd likely say is that digestion and adrenals are 2 huge parts of my practice.
Yeah.
But realistically, people are coming in because they can't sleep, or they want to get off some medications, or they have a history of heart disease in their family and they want to try and avoid that. So why they come in is completely different necessarily than what I come up with for them.
Cool. Guys, it's a great opportunity to get in and kind of talk with a professional that spent 8+ years in university to kind of talk your way through some of the issues. I mean, you guys come and talk to us here, and oftentimes it's conversations that we can't manage, and that's the whole purpose of BlendedTV, is that this is an opportunity for you guys to realize that there's professionals in our area, like Jayme, that can help with certain issues that you might have coming up in your life. So don't just kind of take this as an opportunity and take a little bit of time to go see Jayme. and, you know, explain to her what some of your issues are instead of explaining it to me, because I don't care. No, I'm just kidding. I care. I swear to God, I care. We've also had some awesome things going on here at Blended. Jayme, thanks so much for coming out tonight. We're going to leave you off tonight. We got some new gear, and Scott decided that he wanted to try out, and somehow we caught it on video. Check it out. Have a great night.
I'm here at Blended Athletics. What do we got? Brand new dumbbells. That's right. Now we can do bicep curls like we've always wanted. What's that? Incline bench. 25. Not enough. Let's go, Andy. Pumping. What is this? 100? Where's the 150s? Not this time. All the dumbbells here at Blended Athletics.
That video is too funny not to talk about it, so no, I'm just kidding. But we did want to bring up one last thing. I'm going to leave the floor to Jayme. The month of September, what's going on with your
The month
practice?
of September, I'm offering $20 off initial visits. So it's a 90-minute visit, and normally it'll cost about $170, and I'm offering for $150 for this month for any new patients who want to come in. You can also come in for just a 15-minute meet and greet if you just want to come and chat with me and see if this is really something you want to pursue or not, and there's no cost to that. And I also have a newsletter here, a sign-up sheet for a newsletter that is now going to be monthly to bi-monthly with a health article, a recipe, and some promotion every month.
So that'll be at the front desk. You can sign up for that. And like Jayme just said, month of September, no time better than this. You're getting back into your routine. Get in and see Jayme this month, and $150 is still covered under your benefits.
Mm-hmm.
Awesome. Thanks, Jayme. See you guys next week. Have a good night.